Hello, everybody. Welcome to tonight's virtual event. I am really excited to have you all here. My name is Danielle. I am the community manager at Calibrate, and I am really excited that we are joining forces tonight with Loftie. They are friends and masterminds of the Loftie alarm clock, which is one of our favorite sleep hacks at Calibrate. Our team swears by the Loftie alarm clock. In fact, it was actually our team's gift for New Year's this past year, which was really, really special. So we all love them. So welcome to all of the Loftie community members that are joining tonight. We're really excited to have you and be here. So we are going to leave just a few notes of housekeeping. This is being recorded, and we are going to leave about 10 minutes or so at the end for a live Q&A. That being said, the chat and the Q&A are on right now. So feel free to hop in there if you have any questions, and we'll go through as much as we can at the end of the presentation tonight. And I'm really excited to introduce you to both our panelists. So we have the Calibrate sleep expert, Dr. Vora, as well as the medical advisor from Loftie's team, Dr. Fiona Gispen, and I will let them introduce themselves. But I also wanted to have them both, since tonight's conversation is all about sleep, share their personal sleep hack. So just something to keep in mind, and I'll pass it, Ellen, to you first to kick us off. So introduce yourself and share your personal sleep hack.
Thanks, Danielle. Hi, everyone. So I'm Ellen Vora. I'm a psychiatrist and I'm Calibrate sleep expert. And I suppose my favorite personal sleep hack is basically sunset until bedtime. I'm pretty much always wearing some kind of blue blocking glasses to prevent all the blue spectrum light from interrupting healthy circadian rhythm. So that's why I'm wearing glasses even right now.
Okay, Fiona, your turn.
Hey guys, I'm Fiona Gispen. I'm an internal medicine doctor. I'm a hospitalist here in Nashville, Tennessee at Vanderbilt. I also completed 1.5 years of psychiatry training and teach Vinyasa yoga. I'm Loftie's medical advisor, started working with them back in 2018. And my sleep hack is when I have trouble falling asleep, I take a hot bath. And we can talk about a little bit more why that works later on, but love my hot baths before bed.
That sounds nice. I think I'm gonna have to add that to my wind down routine for sure. Great, so thank you both so much. Really excited to have you here. And for those of you who may not be familiar, I'm just gonna give a quick overview of Calibrate. Calibrate is the first metabolic health company changing the way the world treats weight through a combination of doctor-prescribed GLP-1 medications and intensive lifestyle interventions. And that comes to life through an app-based curriculum and one-on-one video coaching that help improve metabolic health markers and sustain long-term weight loss. And Ellen, as she mentioned, is our sleep expert. So I'm going to pass it over to her just to give you guys a little bit of a better idea of how sleep fits into Calibrate and why it's so important to calibrate in our metabolic health. So Ellen.
Yeah, so sleep is one of our 4 pillars of metabolic health at Calibrate. And basically the idea here is that sleep is absolutely critical to our overall metabolic health. It will completely determine how certain hormones like leptin and ghrelin function, and that goes on to determine our appetite, satiety, our metabolism. And you're going to continue to learn more and more about sleep as you move through your curriculum, and you'll learn really helpful strategies to improve your sleep.
And here's a picture of the beautiful Calibrate app and some examples of the lessons you would progress through if you were a Calibrate member. And then Fiona, want to share a little bit about Loftie?
Yeah. So broadly, Loftie is a brand dedicated to creating better tech life balance for everyone. We really believe that tech should be energizing, not draining. And our goal is to design products that make you feel optimally rested and relaxed. We kind of started with the broad question, how can we help people depend on their smartphones less? As we all know, smartphones have taken over basically everything: socializing, work, alarm clocks, and they're present everywhere, including in the bedroom. When we realized how important sleep is and how much smartphones are messing up our sleep, we really knew this is where we wanted to start. And so that's why our first product is our Loftie clock. And I'm glad you guys love it. I saw that in the chat. So how we think about sleep in Loftie, we really think that getting sleep, we really think about it in three parts, and we've built our clock to help with all three. First is what you do before bed. Second is quality of your sleep itself, so the amount, and then also the proportion of deep sleep and REM sleep. And then third, the process of waking up. So Loftie really helps with all three by getting rid of the bad, AKA your distracting smartphone with its often grating, terrible morning alarm, and then bringing in the good. So a feature that nudges you towards bedtime, our bed signal, a blackout mode, relaxing sounds, and then also a 2-phase alarm that really wakes you up gently.
Awesome. And then before we jump into how we can create a science-backed sleep routine and all the awesome tips that you guys are going to share tonight, do you mind sharing a little bit more like why sleep is so important for overall health? I know Ellen touched on this a little bit earlier, but I'd love to hear more.
Yeah, absolutely. So really getting good sleep is one of the most important things we can do to increase our overall wellness. Bad sleep is really closely tied to many chronic health conditions, perhaps more than you realize. It includes, as Ellen mentioned, metabolic syndrome, so obesity and diabetes, also overweight, impaired fasting blood sugars before we get to that more extreme. Cardiovascular disease, so that includes high blood pressure, coronary artery disease, which can lead to heart attacks and strokes. Also mood disorders, most commonly being depression, anxiety, chronic pain, and then even certain types of cancer and dementias. So as we know, a huge number of people in the developed world are really not getting the sleep that they need this week. And really this results in lost quality and also sometimes even quantity of life.
Great, thank you. Okay. Now, excited to have you guys really dive into how we all can create a science-backed sleep routine and maybe take home some tips for us tonight as we go to sleep after this. Want to kick it off, Ellen?
Yeah, so as I mentioned before, I wear these blue blocking glasses because I think this really critical intervention that we can all do to be strategic, to actually set ourselves up to fall asleep more easily and stay asleep through the night, is to be smart about light. Our whole circadian rhythm is cued by light, and this is our sleep-wake cycle. And the design was brilliant. It worked really well on the proverbial savanna of evolution, where if it was light outside, that meant it was by definition daytime. And if it was nighttime, it was by definition dark out. We could really only see fire and moonlight. And these days, after sunset, we are seeing a psychedelic light show around us, from our overhead lights to our ambient light pollution outside our windows to bringing our phones into the bed with us if we don't yet have a Loftie. So what we want to do is get really smart about how light is getting into our eye throughout the day. Starts first thing in the morning, getting exposed to bright light. But I think the real special sauce happens after sunset, where you can be smarter about how much blue spectrum light is getting into your eyes. Powering down our devices a little bit earlier can be helpful. Making sure we just set it and forget it with the different night shift modes on our phone. You can do something like Flux on the computer. And then, as I mentioned before, blue blocking glasses are a great intervention. They're inexpensive and non-invasive, and they block a lot of the blue spectrum light from getting into our eyes. So it's a really nice support.
And
Sorry.
then, oh no, you're good.
There you go.
There we go. With Loftie, we agree. This is basically the same thing, but get your phone out of the bedroom. Our whole model is based on the importance of getting it out. And this really is because our phones are directly tied to really the two main things that impair your ability to fall asleep. First, too much cognitive stimulation or arousal. And then second, a disrupted circadian rhythm, as Ellen was just talking about. And our phones mess up both. They wake up our brains with our texts, news, Instagram, Wordle, and their blue light really delays our circadian rhythm by suppressing melatonin release. And then finally, some studies also show that our sleep quality is worse after using screens. usually showing that we get less REM sleep. And REM is particularly important for emotional regulation and creativity and creative problem solving. So get your phones out of there.
And so, yeah, so we also want to set up our bedroom to make sure that, and is this one maybe Fiona actually?
Yeah, I think I was.
Oh yeah, got it. Okay, overnight physiology. So
sorry guys, my mouse is freaking out. Here you go, Ellen.
all good. Oh, let's do wind down period. It's all good. We're going to cover it all. So a wind down period is really an empowering step that we can take. In a sense, like we all focus on our alarm that we wake up to in the morning. Probably many of us should also have an alarm that goes off gently, lovingly in the evening that just reminds us now would be a good time to start powering down, to start transitioning towards bedtime. So you kind of want to do the math for yourself. What time in the morning do you need to wake up? How much sleep do you need? How long does it typically take you to fall asleep? And about a half an hour before that is when you want to start the process of getting ready for bed. And so we just have to be kind of honest with ourselves about what time that is and to put that into motion. And I find there's actually this is a validated practice. There's research to back this up, that if we have things on our mind as we're heading into bed, what you want to do is just take out a pad of paper, a pen or a pencil, and jot them down. And I think that this is effective because a lot of us never have space during the day to just be with the kind of background noise where go, go, go. It's like on your marks, get set, now fall asleep. And then as soon as our head hits the pillow, our mind is spinning in a million directions and juggling and thinking like, okay, I got to remember to respond to that email. I need to remember to pick up milk. Oh, that text, I forgot to respond to it. And it's at that moment that our brain is like, okay, let's juggle all these balls. And if we just keep juggling all night, it makes it really hard to surrender into sleep. So even just jotting those things down on a piece of paper helps our brain know it's been outsourced to the paper. The paper is going to keep track of that until tomorrow. We don't have to keep it in our mind. And I think one really nice, just little trick is to recognize that humans have somewhat of an optimal bedtime, give or take around 3 hours after sunset. And what you can find if you start to look for that is that you'll have tired signs. You're going to yawn, you might rub your eyes, you might stare blankly at the wall. And if you go to bed at that moment, that's when we're in that sweet spot. We can fall asleep more easily, stay asleep through the night. What many of us do realistically in our lives is we push past that. We think, well, that's egregiously early for a bedtime and I still have work to finish and kitchens to clean. So we stay up past that point of being perfectly tired. And it pushes us into this state called overtired. And if you don't have kids, you're like, overtired? That's not a thing. You get tired and then you get more tired. But if you have kids, you're like, overtired. I learned that one the hard way with a baby. And so basically overtired is when your body responds to the fact that you didn't go to bed when you're tired by secreting cortisol, our stress hormone. It gives us this second wind. And suddenly we're tired but wired. We almost feel warm. We feel suddenly wakeful, even if we were falling asleep on the couch 10 minutes prior. And that makes it really hard to fall asleep. So we toss and turn and we have less deep sleep through the night. So aim for around 3 hours after sunset. Look for your tired signs. That's a really good time to swoop yourself to bed.
Okay, thank you. Okay, bear with me. Let's see if my mouse works this time. Okay.
Nice.
There we go. So yes, optimize your bedroom. So again, what really impacts the quality of our sleep is how well we're matched with our body's natural circadian rhythms. So darkness and coolness are called Zeitgebers or time givers in German. And this tells our body that it's biological nighttime and really triggers our brain to start releasing melatonin, making us tired. Luckily, we can control these in the bedroom. So keep it dark, cover up all those little red lights on your TV or on your power strip. Your Loftie has a blackout mode. You can kind of press the little top button for 2 seconds and the numbers will totally black out. And also keep it cool. So the optimal sleep temperature is actually between about 65 and 68 degrees. The reason for this is because our core body temperature actually cycles along with our sleep-wake cycle, and our temperature drops by about 2 or 3 degrees Fahrenheit while we're asleep. So if our rooms are too hot and our environment prohibits our core temperature from dropping, then we sleep more poorly. we get less REM, and we get less slow wave or deep sleep. So this is why hot baths help me fall asleep. The bathtub is warm, of course, but when I get out, the water evaporates off my skin, and this actually cools down my core body temperature. So warm, breathable socks also have a similar effect. Having warm feet brings more blood flow to your feet. And then as long as the heat can escape, your core body temperature will be lowered. So you have to make sure that the heat can escape from your socks. So cashmere, merino wool, cotton socks, or there are special sleep socks that you can get on Amazon. Those are the best. And then the other thing that's not on here, but if it's too humid in your bedroom, it's going to be more difficult for your body to cool at night because this evaporative cooling effect decreases. So too humid, it's up to you, but too humid could be bad. And then in terms of sound and sleep, so there's not a scientific consensus that sounds improve objective sleep architecture, meaning that they increase your amount of deep sleep or REM, but many people subjectively experience better sleep or can fall asleep more easily with sound. Continuous background sounds, so white noise or ocean sounds, might be particularly helpful to block out intermittent background noises like voices or conversations. And really, if a sound helps you to relax and to reduce your level of cognitive arousal or racing thoughts, then it's going to help you fall asleep. And so I say do what works for you with sound.
Great, thank you. Getting so many good questions. I can't wait to get to the Q&A. Okay.
So now that we've optimized our bedroom, we also want to focus on our body. And there are a couple different hacks here that I find make a really big difference. I usually encourage people to start with blood sugar. And if anybody here is familiar with that experience of getting hangry at 3 p.m, where suddenly you're picking a fight with your partner and running to the kitchen and figuring out what kind of sweets you have available, this is when our blood sugar is crashing and it induces a stress response. And what I find is for a lot of my patients who have that kind of, whether it's overt diabetes or more subclinical dysglycemia, or just your body being somewhat on a blood sugar roller coaster throughout the day, if you're on that during the day, chances are you're also on the blood sugar roller coaster overnight. It is, after all, our longest stretch without eating. That's why we call it break fast. And if you're struggling with steady blood sugar overnight, that crash can induce a stress response. And then it's going to make your sleep more superficial. It's going to make it harder to drop into the deeper stages of sleep, and you're just not going to wake up as rested. So the definitive solution is a blood sugar stabilizing diet, all the work that you're doing with Calibrate to really support that. There is a hack that has helped some of my patients, which is to do something like a spoonful of almond butter. For some people, coconut oil. Interestingly, even a good quality honey can work for this, but something to give you a safety net of solid blood sugar overnight. And that can blunt a blood sugar crash that might be superimposed on it. And then I don't make any friends with this conversation, but it's important to at least talk about, is to just make really conscious choices around alcohol and caffeine. These are two very separate conversations. Alcohol, we know it helps us fall asleep. It's why we have the culture of a nightcap. It makes us feel relaxed and sleepy. And if the story ended there, it'd be a great sleep aid. And I would tell everyone to go have some wine before bed to improve their sleep. But unfortunately, the body has these ways of responding to the rush of a neurotransmitter called GABA, which helps us relax and helps us fall asleep. And that's what alcohol creates. But our body sees all that GABA and it thinks we're too buzzed to survive in the event of a threat. So it converts the GABA to a different neurotransmitter called glutamate. And that's an excitatory neurotransmitter. And that's why when we drink before bed, we sort of have a less restful, more tossy-turny kind of second half of the night. It's that glutamate effect. There's also blood sugar crash that can happen after most alcohol. So alcohol is not doing our sleep any favors. The tricky thing here is that we have to make personal self-loving choices. Sometimes the act of self-love is to have that shared experience around alcohol. But oftentimes, if we really look at it, we ask ourselves, is it worthwhile? Sometimes it's not. So we just want to be making those choices for ourselves. Caffeine, separate conversation, but basically some of us are sensitive. Some people are not. Like if you know you can have an espresso after dinner and still fall asleep and sleep well through the night, Good for you. That must be nice. Some of us are slow metabolizers and we're more sensitive to caffeine. And if that's the case, it's worth taking a really good look at if you modulate your caffeine intake, both how much you take in and what time of the day you take it in, it might impact your sleep quality. And a really important PSA here is don't make any sudden changes with your caffeine consumption. It's a very real drug with a real withdrawal, and making changes to it can leave you feeling irritable, headachy, certainly tired. And so you might just want to try tapering very gradually over the course of weeks, even months, and see if you get down to a lower amount of caffeine or you push it a little earlier in the day. Does that set you up for better sleep at night?
Consistent wake up. Again, difficulty waking up is driven by lack of sleep and also by our bodies being out of sync with our circadian rhythms. So the more consistent our bedtime and our wake up time, including unfortunately on weekends, the easier we're going to find waking up, because the more in sync we're going to be with our circadian rhythms. That groggy feeling that you sometimes have after waking up, that's called sleep inertia. And it can last anywhere between a few minutes to at worst a few hours after you wake up. It's the worst when you're awakened from a deep sleep or when you're recovering from a sleep debt. When I was a kid, I used to have such terrible sleep inertia. And I think that's because I was often waking up from deep sleep. Children typically get more deep sleep, and then the amount of deep sleep you get as you age decreases. Usually you get your deep sleep on the first half of your night, so the early part of your circadian rhythm, and then the second half of your circadian rhythm night, you're getting more REM sleep. So if you're on your circadian cycle, you're less likely to be waking up during that deep sleep phase, and you're less likely to experience sleep inertia as well. So stable wake and bedtimes are really key. Interestingly, there's some evidence that melodic alarms can actually help reduce sleep inertia. So if this is something that you struggle with, try a melodic alarm. At Loftie, we have a melodic alarm, and it's also a two-phase alarm. So scientifically, we wake up in two stages. Imaging studies, so fMRIs or functional MRIs, show that first we reestablish conscious awareness in the deeper part of our brains, so we become conscious. And then slowly over the next 20 to 30 minutes, we reestablish alertness. And this is kind of that period of sleep inertia. Loftie's two-phase alarm mirrors this. We have the wake up and then the get up tones. There's a melodic, gentle 30-second wake up tone that helps you reestablish consciousness. And then you get some time to start becoming alert before the get up tone fully wakes you up 9 minutes later. So there haven't been any scientific studies yet about whether this reduces sleep inertia or whether it reduces the sympathetic surge when you wake up, which can sometimes raise your blood pressure, raise your heart rate rapidly, result in a huge spike of cortisol. But I've personally found it much easier to wake up with the two-phase alarm. And so maybe we'll see studies on this in the future.
Awesome, thank you. So that wraps up all of our sleep tips for this evening. And I thank you both for sharing them. I thought they were really, really great and super helpful. Want to dive into some questions, but we have a couple minutes left. There seems to be a lot of questions about temperature, actually. So I see a couple in here, specifically about what's the best temperature to sleep in, and if it's okay to sleep in a colder temperature. I know you touched on it being too hot, but can you speak a little bit to that maybe?
Yeah, sure. So I would say in general, our bodies are very good at regulating our core temperatures. There have been many studies that show that sleeping in a colder temperature, we have many things in our environment that can make us warm. So we have our blankets, we have our socks, we have any sort of pajamas that we wear. And so in general, our bodies are better at keeping us warm and warming our core temperature at night than they are at cooling our core temperature down. So in general, I would say it's better to sleep in a colder room than to sleep in a room that's too hot. I saw one question on there about whether 70 degrees versus 68 degrees is too warm for solid sleep. I would say 70 is okay. Sometimes if you have little kids, you've probably seen this a lot, but sometimes you tuck them in all nice and cozily, and then you go into their bedroom later and their arms and their legs are dangling outside the covers. The reason that happens is we are trying to release more heat from our extremities, from our hands and our feet, and we're able to do that outside the covers. So our body, if you're sleeping at 70 and your optimal temperature maybe is 68, maybe you'll throw off the covers in the middle of the night, and that's okay. So in general, I would say colder, better than warmer, but our bodies are pretty good at regulating within this range between 65 and 70. If at 70, you're having a lot of problems going to sleep, try to turn down the temperature a little bit, see how you do.
Makes sense. Another good one I thought I could ask was, any suggestions on sleeping well during menopause years?
Yeah, I think we probably both can speak to that. I'll throw a couple ideas out there. And I think it actually, in my mind, relates to a question that came a little later, where someone said, what do you suggest / recommend for someone who wakes up consistently between 2:30 and 4:30 a.m.? So menopause is a tricky situation when it comes to sleep. I usually think about sleep issues as being eminently treatable with a few exceptions. I think jet lag, shift work, and menopause are some of the trickier situations. So I think that there is a certain amount of being okay with the fact that sleep is going to be disrupted through menopause, and not so much be at war with our bodies about that, but be more skeptical about the societal pressures that are put on us, that we're supposed to have this perfect consolidated block of sleep and then be able to go during the day. So I encourage people to figure out if there is any wiggle room to be more gentle with ourselves, to have the ability to take a little nap in the afternoon, to expect less from the overnight sleep, so that we're not setting ourselves up for disappointment with it. And I think that one thing that I have found really is a powerful mindset shift for a lot of my patients is to recognize that a lot of us don't actually sleep solid 8 hours through the night, but we actually have a little wake up in the middle of the night, separating two equal chunks of sleep. So if you're someone who typically needs 8 hours of sleep, you might have 2 4-hour blocks of sleep. And in the middle, there's a wake up. It's actually called middle sleep, which is a really poorly named thing because it's really middle wake up, but it's called middle sleep. And that's a time when you might wake up, you might rotate, you might need to go pee, have a sip of water. And I think the utmost importance is to recognize that it's a normal physiologic process, and to not get into a whole narrative about, oh no, this means I'm up in the middle of the night. This means I'm going to have a bad night of sleep. This means tomorrow's going to be a bad day. We tend to spin all these stories that then work us up into a stress response. And then indeed, it is difficult to fall back asleep. So if you can avoid looking at the clock, and most of all, avoid looking at any screen or any light or anything that will trick your circadian rhythm into thinking that the sun is rising, what you really just want to do is pee, have that sip of water, try to lie back down, put your hands on your belly, take a few deep breaths, and basically lie there trusting that this is middle sleep, this is normal and physiologic, and if you give it some time, you're going to naturally fall back asleep. So it's not a solution to menopausal sleep issues, but at least helps us with the drama that can sometimes create a worse night of sleep when we wake up in the middle of the night. I'm really curious to see, Fiona, if you have other suggestions for menopausal sleep.
I will say that the sock thing, I was actually looking this up before our webinar, and I found that socks can sometimes be useful if you're having trouble, in particular with menopause. I'm not sure why that is, but I did find that.
That's interesting.
I'm glad though that you touched on having to go to touching on middle sleep and having to go to the bathroom, because that was another Q&A that came in like right as you were talking about it. So that was perfect timing for sure. Another question that keeps coming up, and maybe this will be our last one since we're just about at time, but Any suggestions for people who use like a lot of meditation apps on their phone to help them fall asleep? And how do we get the phone out of their bedroom if we want to use it to help us meditate? Any suggestions there?
Well, I will say Loftie can connect by Bluetooth with your phone. So what you could do is you could connect your phone to your Loftie, start your meditation, and then get your phone out of your bedroom. So that's one option. Loftie also does have sleep meditations built into it, so you could try those. That would be my big thing. And then the other thing actually that I will mention is that I really enjoy doing a body scan meditation by myself. So I try to guide myself through this. So I'll start with my feet and just say, really relax, try to increase this heaviness in my right foot and then go up to my calf and all the way around my body. And I find that works really well for me. It also, I will say, takes some concentration to remember where you're going. And then that act of trying to concentrate puts me to sleep. So you could also try that.
It's a great idea. Okay, well, thank you guys both so much. I know there was a couple of questions we didn't get to. We can put them into our recap after this event. And when we send out the recording, we can also share the blog posts that our team posts and some of the answers to these other questions. We'll make sure to get them from both of our experts here. Thank you all for joining us tonight. Stay tuned for some more information on how to get Loftie or how to join Calibrate. And I hope you guys all have a great evening and sleep well. Thanks, guys. Good night.